So myself, I'm Taryn Hutchinson.
And I'm Halina Gleeson.
And the two of us today, we're just going to be giving about a 20-minute presentation on an overview of what mood disorders are in adolescence. This talk's going to feature looking at what low mood is, thinking about when it becomes maybe a bit of a problem, looking at maybe how parents can get involved a little bit and help support their child, and then thinking about what we as a CAMHS service offer as well. So to start off with, we thought we'd look at actually the idea that it's quite normal for mood to dip during our adolescent years, and that doesn't necessarily mean that somebody has depression, but as I'm sure we're all aware that sometimes we feel better and sometimes our mood does dip. So these are just a few of the kind of causes that we looked at that can cause kind of normal dips in mood. So this idea of situational triggers, by that we mean things like exam stress or kind of fallouts with friends. Transition to secondary school can be a really difficult time for some young people, particularly if their friends are going off to different schools. And the idea as well are physical changes. So we're growing up, we've got all these hormones racing around our bodies, you always hear it, but sometimes actually that can just cause our mood to dip a little bit. This idea of a loss of interest in activities. So as we grow up, we start to get different interests, things that we were interested in a couple of years ago, maybe not so important to us in our teenage years. That's kind of all normal when we're a teen. This idea of normally wanting to have more independence. So as we get a bit older, it becomes quite common that actually we stop talking to our parents and maybe start talking to our peers a bit more. And sleep difficulties. So as teens we're growing, so that kind of means that we need to have time to repair ourselves as well. So we tend to find that we're a lot more tired, need a bit more sleep. These are kind of common things that happen when our mood can dip sometimes as well. So what about when it becomes a problem? So the next two slides are all about kind of signs and symptoms of low mood and depression. The first of all being that idea, that feeling of unhappiness for most of the time, that feeling useless, inadequate or hopeless. Increasingly withdrawn, the idea that actually when we're feeling a bit low, it's really tempting to just want to carry yourself off, go be by yourself and just be alone. But what we actually know that whilst that is tempting to do, it can also lead to us feeling worse. The idea of loss of enjoyment and pleasure in activities. So not just kind of losing interest, but actually all sorts of things. We're just not enjoying them as much as we have in the past. And that can kind of reduce our motivation to do things if we're not enjoying them. This idea of difficulty making decisions. When we're feeling low, just actually everyday tasks seem a bit more difficult. And that idea of can't cope with things that you used to. So that, like, say a sibling that winds you up, that kind of gets your goat sometimes. Once upon a time, you might have just been able to laugh it off. But when you're feeling low or feeling depressed, those things get harder to cope with. This idea as well of feeling irritable, restless or agitated. So I suppose if there are things that you want to be doing, but your low mood is getting in the way of those things, it can be quite frustrating actually. A loss of self-confidence and changes in appetite. So some people, they find that they really lose their appetite, don't eat as much and tend to lose weight sometimes when they're feeling low. Other people find actually they get increased appetite and seek comfort in food. Tiredness and poor sleep. So I don't know if anybody's had this before, that actually when you've got a problem kind of whirring through your mind, particularly when you're about to get off to sleep, the most inconvenient time, you start thinking about all the bad things that have happened, making you feel rubbish and really getting in the way of you sleeping. So consequently the next day you're probably feeling quite tired. And what we know that actually tiredness really interacts with our mood as well. And again, we find it hard to kind of cope with the day-to-day tasks. So that's where we talk about this idea of a significant impact on daily functioning. This idea of self-harm, another indicator that somebody's feeling low or depressed. Typically when we think of self-harm, it's quite common to think of cutting as a form of self-harm, but actually things like kind of punching walls and hurting yourself or scratching at the skin, again, are actually forms of self-harm. And this idea of suicidal thoughts as well, so not wanting to be here, just wanting everything to stop, or even making kind of a plan about how you might end your life. All really significant indications that somebody's feeling low or depressed. So what we know that when we feel low is that low mood gets maintained by this idea of a vicious cycle. So typically we start off just feeling low, Because we're feeling low, this means that we're feeling tired. As we've just talked about, actually, low mood can get in the way of sleeping, so we're feeling tired. Because we're tired, we've got less motivation to go out and do things. This might mean that we stop doing things that maybe we've enjoyed in the past, or just stop doing things like talking to friends, so we do less. Consequently, because we've stopped those things, it feeds back into that feeling of low, and the cycle goes round and round and round. So what can parents do to help? So the first thing we've suggested is about encouraging interaction and communication and regularly checking in on your child. So those of you who have a child or an adolescent might know that on paper that sounds like a really good idea, but then actually trying to do it becomes more difficult, particularly as teens are growing up, they find it more difficult to talk to their parents. So one of the ideas that we suggest for people to try out is this idea of a traffic light system. Which means that the parent would say to their child, what colour are you feeling today? And the child can either respond by giving the colour or can kind of use a coloured card. And the colours sort of mean that red would be, I'm not having a good day, I'm feeling quite low. Amber would be, I'm okay today. And green would be, yeah, I'm feeling good today. The reason this is quite useful for some families is because that it encourages the communication without having to actually go into too much detail. So for the young person that finds it difficult to talk about what's going on, they don't have to go into detail, talk about triggers, they just kind of give the parent an indication of where they are today. And this can kind of help the child feel like, okay, at least someone knows what's going on, that's why I'm acting the way I am. And for the parent, at least they've got an indication, okay, today's maybe not such a good day, and they're aware. The idea of liaising with school if needed. So sometimes we talked about that idea of reduced motivation. So it's quite typical that when people are struggling with mood, that things like homework and going to school even can become quite difficult. So letting school know of the difficulties and looking at how they can support the young person as well. Speaking to your GP or school nurse if you feel that further support is needed. So those are the people that can get you in touch with CAMHS. And then thinking about your own well-being as well, the last point on that slide. So I guess we all know that if you're a parent with a child that's feeling depressed or low, that can be quite an anxious time for you as well. Maybe not understanding how they're feeling or not kind of knowing where they're at. So it can be really useful sometimes to branch out to your social networks as well, speaking to your friends or other parents. And I guess it helps give that reassurance that either, yeah, this is just a normal kind of teenage thing that's happening, or actually maybe we need a bit more support. So that's why we've put that last one about kind of thinking about yourselves as well.
Okay, so carrying on from what Taryn was just saying there about practical things that you can do. So thinking about 5 ways to well-being. So this was based on a bit of research that was done in about 2008. Thinking about practical things that we can all do to improve our mental well-being, to help us feel more resilient and to improve our self-esteem. So this wasn't just thinking about people who have low mood, this is thinking about actually all of us can be doing these 5 things more regularly to improve our mental well-being. So if we just go through them all in turn, so connecting is the first one. So I'm sure we all know from personal experience why connecting with other people might be good for our mood. Okay, so it can be fun, you can get enjoyment from that, it can boost your self-esteem that actually other people want to connect with you, it can give you someone to talk to about any difficulties, and it can provide a good distraction from your low mood or any difficulties that you're having. So that might be connecting with friends, it might be connecting with family, and it might not necessarily even be face-to-face, so giving someone a phone call or over email or various social media that people use. So that's the first one, connecting. Then we've got be active. So you can see quite a few active looking pictures there, but when we say be active, we don't necessarily mean going to the gym or going for a 10-mile run. It can really be really small activities that you're doing. So walking around the block, taking the dog out, little things that you can do to just be out and about and keeping active. And that can have a really positive effect on our mood because we can feel quite good about ourselves that we've done that today. When we exercise, it releases hormones that make us feel quite positive, and also it can kind of link to the first one and give you an opportunity to connect with other people if you're going to clubs or classes or things like that. So being active is another really useful thing that we could all be doing to improve our mood. Taking notice, the third one, is a little bit of a different one to the first two. So this is thinking about stopping and taking notice of little things that can have a good impact on your mental well-being. So for example, if you are out and about for a walk, just stopping and noticing perhaps a nice view or perhaps the scenery. Or if you're out with your friends or family, just stopping and noticing, you know, I'm having a really good time, and taking notice of that. And kind of really picking up on the small things that can have a positive impact on your mood. So just taking that time out to take notice. Keeping learning is the fourth one. So this isn't just thinking about school, it can be skills that you do, hobbies that you do, and kind of keeping active and keeping up with those extra things that you do can have a positive effect on your mood. Mainly because if you enjoy it, that's going to put you in a good mood, or it can be quite distracting again. And actually you can feel quite good about yourself if it's something that you feel you're good at. So for example, I don't know, baking can feel quite good at the end result of baking a cake. And the fifth one is give. So this is thinking about the idea that actually for quite a lot of us, it can put us in a good mood to do things for other people. So that idea, I'm sure you've all perhaps given a birthday present or a Christmas present where actually it's made you feel quite good that you've given a good present. And that's what this is thinking about. So it doesn't have to be big things like volunteering. If people want to do that, then that's great, but it can be small things. So, you know, helping mum and dad at home, doing things with your friends, just small things like, I don't know, making someone a meal, opening the door for them, or giving them a smile. So kind of small things that you can do in each of these categories. And like I say, these are things that we can all be doing, not just people with low moods, and they can all have a positive effect on our mental well-being. So thinking about, as Taryn said earlier, if you speak to your GP or your school nurse, that's how you can get referred into our service, CAMHS. So usually people who get referred in with low mood are referred to myself or Taryn, and we form the PWP service. So we offer 4 to 8 sessions of low intensity CBT for low mood. We do offer other sessions, but that is what we offer for people who come in with low mood. We don't routinely offer medication before someone has received a psychological intervention, or at least it's offered alongside. And the reason for that is because it's following national guidance, which says actually a young person should be offered psychological intervention first or alongside, rather than just being offered medication straight away. And a lot of the studies that have been done on medication have actually been done with adults. And a lot have found that actually if someone has quite mild or only moderate depression, actually the medication doesn't always have much more effect than a placebo. So actually we think it's quite useful if a psychological intervention can be tried first, and that can be useful, and that's really helpful. So I've just mentioned the word CBT there, and I'll go on to explain what that means in another slide. So if you get referred to myself or Taryn for sessions, there's a few things that you can expect. So you'll be offered 4 to 8 weekly sessions, and these last about an hour each week. So obviously it's really important things like timekeeping, making sure you're there on time, and we try and stick to that as well, making sure we're there on time and we give you that hour that you need. And thinking about the fact that they are time limited, so we do set a number on the amount of sessions that we offer people, 4 to 8. Sometimes that can be extended slightly, but usually towards the end we're thinking about actually can this person either be discharged from our service, or perhaps they need more support from our service, perhaps with another member of the team. Confidentiality, obviously really important, so it's just like when you go to a doctor's appointment, everything in our sessions is completely confidential, so the young person can be confident about that. We're not going to go out and talk to anybody about it. We do sometimes talk about things amongst our team or between each other or with our supervisor, but apart from that everything is completely confidential. There is a side point to that, obviously, thinking about sometimes we might feel it's important to break that confidentiality if for some reason we're concerned about a young person, or if they're saying something that actually we think someone else should possibly be involved. And if that was the case, we would speak to the young person and warn them that we were going to do that, and check with them who might be the best person to speak to. So it would have a conversation around that, but that's really important for parents to know that actually even though sessions are confidential, we do break that confidentiality if we feel it's really important too. In all of our sessions, we ask people to come up with goals, so things that they want to specifically work on and achieve throughout our sessions. And the reason for that is because often people have quite different goals when they come to CAMHS, or quite different things that they want to get out of our sessions. And that just makes sure that we're really focusing on what the young person wants to work on. And it gives us a good sort of measure to look at every session to see if their goals are improving, if they're working on what they want to work on, And if not, is there anything we could be doing that could be more helpful? So it's a good way of keeping that measure. And that's similar to the questionnaires. So I'm sure anyone that's been to our service will probably know that you get given quite a few questionnaires, and that's really important, again, as a kind of way of keeping a baseline measure across our sessions. So myself and Taryn, particularly for this programme, we would give out a questionnaire focused on symptoms of low mood. So we can then repeat that questionnaire throughout our sessions and see if that person's symptoms of low mood are changing, improving, hopefully not getting worse. But again, then we can use that to see if there's any more support that we could be giving. All of our sessions aim to be very structured. So we'll always have something that we specifically want to focus on in a session, and it's based on learning particular skills. So we'll always have something that we want to cover in the session, but obviously there's time within a session if the young person needs to bring anything else to discuss. Homework tasks are a really important part of CBT. So that's thinking about just making sure that the young person is going away in between sessions and thinking about the skills that they've learned and practicing what we've talked about. Because it can be quite easy to forget with a whole week in between going to school about what we've done last session. So it's just making sure that they're really working on what we've talked about. And that's also a useful point where parents can get involved, because we can often liaise with parents, even if they're not in the session, to say, you know, this is what your child's homework is this week, can you remind them to do it? Or perhaps if you want to have a read of it so you know what we've done in session, then maybe you want to have a look over it as well. So that's another point where parents can help and get involved if they want to. So I mentioned in the previous slide that all of our sessions are based on CBT. So CBT stands for Cognitive Behavioural Therapy, and basically is based on this idea that in any situation, our thoughts, our feelings and emotions, our physical symptoms and our behaviour are all linked. And what we do in CBT sessions is we try and focus on giving the young person skills to work on changing their thoughts, their behaviour and their physical symptoms to have a positive effect on their feelings. So giving them the different skills. Quite often people might come to CBT sessions and tell us about different triggers that might be having an effect on their emotions, but what we're really focusing on in our sessions is the skills of working on those thoughts, that behaviour and those physical symptoms, rather than any external triggers, because actually sometimes they can be things that we don't necessarily have any control over. So if you were to come and see us for sessions, just think about what you can expect and what we'll cover. So there's a picture there of the book that we like to use alongside our 8-session programme. There are a couple of copies at the front of the room, so if you want to have a look at the end of the presentation and have a flick through it, they are quite useful. And that book covers the same topics that we cover in our sessions, so things like psychoeducation, so explaining to the young person what low mood is, why they're experiencing the symptoms they're experiencing and why they're feeling the way they are, and just getting a good understanding of that first. Then we would think about behavioural activation, so positive behaviours and ways that the young person could possibly change their behaviour a little bit to have a good effect on their mood. We think about problem solving, and the fourth one, noticing and changing unhelpful thinking styles. That's thinking about the fact that actually when we have low mood, we often have quite a lot of unhelpful, negative thoughts popping into our head that can be really hard to get rid of and can have a really maintaining effect on our low mood. So that's thinking about how you can spot those and what you could possibly do about those. And for some young people, it's also relevant to go over some sleep hygiene, so tips and advice on what could help them get a better sleep. As Taryn mentioned, that can be quite a common difficulty that people have. So we've got a couple of useful websites there, which I would suggest that you have a look at. The third bullet point is the name of that book that I've just pointed out, which we also said we've got a couple of copies at the front if you want to have a look at. And the Living Life to the Full series, I think some of you have already noticed, there's some books at the back of the room which are free for you to take away. And they're just little self-help books, quite colourful, quite easy to read, and they're written by the same person who wrote the textbook that we use, and they're quite useful. So if you want to have a flick through and take those away, then feel free to grab any of those at the end.